In this program, we're going to get into the components of program design, from assessment to training principles, to periodization to training loads. Let's begin where you'll begin. Assessment. Start every exercise program with an assessment of your client's physical fitness level. Assessments take place on your first or second meeting with a client once you have reviewed your client's health history in depth and have obtained clearance from a physician if necessary. Depending on the client's age or cardiovascular history and health, a client's physician may recommend that he or she undergo a graded exercise test, a GXT, before beginning an exercise regimen. There are two types of GXTs, a symptom-limited maximal GXT and a submaximal GXT. The symptom-limited maximal GXT involves the progressive increase in exercise intensity until signs or symptoms of exertion intolerance occur. The submaximal GXT involves the progressive increase of exercise intensity until a predetermined endpoint is reached, or until a sign or symptom of exertion intolerance occurs. For most clients, exercise intensity should be between 55 and 85% of your client's maximum oxygen uptake capacity, VO2 max. There are several ways for you to estimate this. The most widely used methods are target heart rate, THR, rating of perceived exertion, RPE, and metabolic equivalents, METs. When using heart rate to predict VO2 max, you can use either maximal heart rate or the Karvonen formula, which incorporates heart rate reserve. 70 to 85% of maximal heart rate, without any adjustment, approximately corresponds to 60 to 80% VO2 max. Maximal heart rate is 220 minus age. To find the target heart range at 70 and 85% of the maximum heart rate, simply subtract the client's age from 220. Then multiply by 0.7 for the low estimate and by 0.85 for the high estimate. The Karvonen formula is more accurate and corresponds more directly to VO2 max. 60 to 80% of heart rate found with the Karvonen formula equates to 60 to 80% VO2 max. Rating of perceived exertion, RPE, refers to the physical strain individuals believe they are experiencing while exercising. A drop in RPE is often one of the first readily recognizable measures of positive changes in aerobic fitness. One metabolic equivalent of task, or MET, is equal to the amount of oxygen your body uses at rest. So, an activity that has a value of 4 METs roughly uses 4 times the amount of oxygen. METs are general values, and as we know, different activities require a different amount of work for different people. Therefore, target heart rate and perceived exertion are more reliable and individualized methods of measuring exercise intensity. There are several simple methods to assess cardiovascular endurance. The 12-minute run-walk test, 12-minute swim test, 12-minute cycle test, and the Kosh Pulse Recovery Step Test are some of the more common methods. The 12-minute tests are simply the distance that one can cover performing one of the 3 activities listed for the duration of 12 minutes. The Kosh Pulse Recovery Step Test measures the pulse for 1 full minute after completing a 3-minute step test. The results of all 4 of these tests are compared to standardized results to determine a cardiovascular fitness range for the participant. To assess your client's muscular strength, you'll estimate how much weight your client could lift in one all-out maximum effort. This is known as 1 rep max. The safest way to determine 1 rep max is to ask your client how much weight he or she can successfully bench for 10 repetitions and leg press for 10 repetitions. Have the client perform each exercise with the amount of weight he or she has indicated, and count the actual repetitions completed. With this count and Table 16.1 in your course materials, you can estimate 1 rep max. So, let's say your client has chosen to bench 100 pounds for 10 repetitions, and he maxes out at exactly 10, unable to lift the bar for an additional rep. According to the chart, the weight he has lifted is 75% of his 1 rep max. To estimate his 1 rep max, divide 100 by 0.75. His 1 rep max is estimated to be 133 pounds. Let's say another client has also chosen to bench 100 pounds, but he is only able to complete 6 repetitions with this weight. According to the chart, the weight he has lifted is 85% of his 1 rep max. To estimate his 1 rep max, divide 100 by 0.85. This client's 1 rep max would be 118 pounds. Once you have an estimated 1 rep max, you can see how your client compares to general strength norms. Simply divide your client's 1 rep max by his or her weight in pounds. Flexibility is another important component of fitness and must be assessed as well. There are several simple methods to assess flexibility. The zipper stretch and the sit and reach test are 2 of the more common methods. Muscular endurance can be assessed through a variety of methods. The push-up test, sit-up test, squat test, and the walk test are some of the more common methods. These tests all involve counting the maximum number of repetitions or distance that can be completed in a set period of time, most commonly 1 minute. Once we have assessed our clients, we can move on to planning the workout. There are at least 7 overlapping principles for designing effective programs. These 7 principles, which we will review now, are known as the 7 Granddaddy Laws. The principle of individual differences states that while we all will have similar responses and adaptations to the stimulus of exercise, the rate and magnitude of these changes will be limited by our differing genetics. The overcompensation principle states our bodies will compensate to handle any repeated stress that our systems face. The overload principle states in order for gains to continue, the intensity of the stress imposed must be progressively increased. The SAID principle, which stands for Specific Adaptation to Imposed Demands, states that our bodies will physiologically adapt according to whether we are training aerobically or anaerobically. The use-disuse principle states that our bodies will adapt to current exercise or lack thereof. Simply stated, use it or lose it. The specificity principle states that we must move from general training to specific and highly specialized training as it relates to our intended goals. The GAS principle, which stands for General Adaptation Syndrome, states that we undergo stress in 3 stages: shock, compensation, and exhaustion. Therefore, we must train in cycles to account for these various stages. Some popular systems in the fitness marketplace today include ABC Training, Bigger, Faster, Stronger, BFS, Starting Strength, CrossFit, High Intensity Training, HIT, and home exercise programs. None of these systems adhere to the 7 Granddaddy Laws. The Weider system has been in existence for over 50 years and has grown over time to incorporate other great training ideas as they came along. There are 3 broad categories of Weider principles. 1. Principles to help you plan your training cycle. 2. Principles to help you arrange your exercises in each workout. And 3. Principles to help you perform each exercise. There are over 34 principles outlined in your course materials to help you develop your training programs. We will go over them briefly now. For planning your training cycle, we have split training, double or triple split training, progressive overload training, holistic training, eclectic training, and instinctive training. For arranging your workouts, you can choose multiple sets, supersets, compound sets, trisets, giant sets, staggered sets, rest pause, pre-exhaustion, pyramid sets, and reverse sets. In performing your exercises, you can adhere to the isolation principle, cheating principle, continuous tension principle, forced repetitions principle, flushing principle, burn principle, partial repetition principle, super speed principle, peak contraction principle, isotension principle, or the retrogravity principle. This list of methods is totally flexible and can be manipulated to optimize your and your client's training goals. The FITT principle is an excellent way to organize any training and is comprised of 4 components: Frequency refers to how often you will exercise each week. Intensity is reflective of how hard your client will exercise during each training session. Time refers to the duration of the training session. Type of exercise is the kind of exercises and methods you will use. The 5 R's can be applied by beginners and intermediates. The highly specialized needs of elite clients cannot always be met with the R's principles. Range of motion refers to the complete movement capability of a joint. The targeted muscles in an exercise should be stressed from a fully stretched position to a fully contracted position. Resistance refers to the amount of weight moved. Resistance must be light enough to allow movement through the full range of motion, but heavy enough to tax the muscle for the desired number of repetitions. Repetitions, or how many times the exercise is done in one set, are highly specific. Generally, 3 to 8 repetitions produce absolute strength. 10 to 20 repetitions produce anaerobic strength endurance, and 20 to 40 reps produce aerobic strength endurance. Rest is the amount of time a muscle needs to recover between sets. Muscles need about 2 to 4 minutes to replenish their ATP and function near full capacity again. Recovery is about allowing your body to recover from the training session by not overworking the same muscle. In general, beginners should not exercise the same muscle group 2 days in a row, and usually not more than 3 times per week. Overtraining is an accumulation of stress, which results in a long-term decrease in performance capacity. Restoration of performance capacity after overtraining has set in can take several weeks to several months. Though there are several physiological markers of overtraining, the most common are sympathetic and parasympathetic nervous system overtraining. Sympathetic overtraining is more commonly found in individuals who participate in anaerobic training. The symptoms can include increased resting heart rate, increased blood pressure, loss of appetite, decreased body mass, sleep disturbances, emotional instability, and elevated basal metabolic rate. Parasympathetic overtraining syndrome is most often found in aerobic exercises, and its symptoms include early onset of fatigue, increased resting heart rate, decreased heart rate recovery after exercise, and increased resting blood pressure. Excessive training refers to the training in which the volume, intensity, or both are increased too quickly without proper progression. Muscle soreness that occurs directly after a workout is known as acute muscle soreness. It is often referred to as DOMS for delayed onset muscle soreness, or PEMS for post-exercise muscle soreness. The physiological mechanisms causing DOMS or PEMS are not completely understood, but the leading hypotheses are the 1. Connective tissue damage hypothesis, 2. Skeletal muscle damage hypothesis, and the 3. Spasm hypothesis. The connective tissue damage hypothesis suggests that the DOMS is due to disruption in the connective tissue of the muscle and the tendinous attachments. The skeletal muscle damage hypothesis is supported by a 1986 study which demonstrated that serum creatine kinase levels, an enzyme released by damaged skeletal muscles, were elevated in relation to perceived levels of DOMS. The spasm hypothesis suggests that ischemia, or decreased blood supply during exercise, causes pain-causing substances to build up in the muscle. These substances cause the muscle to spasm and produce more ischemia, which causes the pain to increase over a 24 to 48-hour period. The best way to minimize the risk of overtraining is to follow cyclic training procedures. This is done by alternating easy, moderate, and hard periods of training, also known as periodization. As a general rule, 1 or 2 days of intense training should be followed by an equal number of easy aerobic training days. Integrating a recuperative scheme into the training schedule can mean the start of new progress, even after long periods of stagnation. Periodization refers to how a training program is broken down into discrete time periods called macrocycles, mesocycles, and microcycles. In simple terms, periodization is a way to organize training goals. Metaphorically speaking, imagine a macrocycle is a dollar bill. A mesocycle would then be considered a quarter, and a microcycle would be like a penny. Keep in mind that these terms are simply used for training organization. Hans Selye's General Adaptation Syndrome, or GAS principle, has demonstrated that the body will go through 3 predictable stages in response to stress: shock, compensation, and exhaustion. Therefore, cycling your training to account for these stages is imperative for program success. Not doing so can lead to overtraining. Periodization is a gradual process with the goals of each mesocycle oftentimes blending together. In the foundational period, the main purpose is to strengthen weaknesses, recover from any injuries, and develop a foundation of strength in all muscles, tendons, and ligaments. It is also in the foundational period that skills for sport-specific training are developed. In the functional or sport-specific training mesocycle, training is done closer to the energy pathway needed for your client's particular goals. Furthermore, focus will be on the body parts that are more directly involved in the goal. If your client is training for a specific competition or sport, pre-season training will focus only on specific skills needed for the sport or competition. This mesocycle is only for high-level clients. In-season training is when organized practice begins and is dictated by a head coach. A period of active rest should follow the season before beginning the cycle over again. Even if your client is not involved in a sport, his or her training program should still be periodized with the goals of each training period setting the stage for the training methods that will be utilized in the future. For periodization to be effective, we as certified fitness trainers must understand how to properly prescribe training loads. It is imperative that you are able to determine the appropriate loads and repetitions necessary to bring about the desired goals of your clients. When discussing assessments, we touched on using the 1 rep max to identify a client's fitness level. Now, let's use the client's 1 rep max to determine his or her training load. Maximum power will occur somewhere between 55 and 85% of the 1 rep max. Therefore, the training load should be somewhere between 55 and 80% to facilitate a training effect. This range is considered the appropriate training zone for most resistance exercises. High repetition resistance training, consisting of 15 repetitions or more and utilizing less than 65% of 1 rep max, does not encourage type 2 muscle fiber hypertrophy. Powerlifting, consisting of 2 to 6 repetitions at 85 to 95% of 1 rep max, does not allow for sufficient time to activate all motor units in an orderly fashion. In this type of exertion, only a type 2B muscle is being heavily activated. Since the other fibers are not being activated, this muscle will not reach its full growth potential. To maximize serum testosterone and growth hormone levels and allow for successful recovery, adaptation, and muscular growth, here's the formula. 8 to 10 repetitions at 75% of 1 rep max for 3 sets, with a maximum of 1 minute rest between sets. Let's suppose you are training your client for hypertrophy, and you have determined that 150 pounds is 75% of his 1 rep max of 200. You begin training him, and as a result, he begins to get stronger. How do you know when to increase his weights? And will this change the percentage of his 1 rep max? The answer to this is rather simple. The number of reps you can accomplish with any given weight is reflective of its percentage of 1 rep max. As your client gets stronger, his 1 rep max will increase. So, 75% of his 1 rep max will no longer be 150 pounds. If the client wishes to continue training for hypertrophy, he must continue with a weight that is heavy enough to max out at 8 to 10 reps. If he can successfully complete 2 or more repetitions above the desired repetition range in the last set for 2 consecutive workouts, increase the load by 2 to 10%. Depending on his physical abilities. Lifting weights in and of itself does not constitute training. Rather, it is an integral part of a fitness lifestyle that includes a multitude of facets. The ISSA integrated training approach includes heavy resistance training, light resistance training, psychological techniques, therapeutic modalities, medical support, biomechanics, dietary manipulation, and nutritional supplementation. Heavy resistance training is exercise with heavy external resistance, such as dumbbells, barbells, and other resistance devices. Light resistance training includes running, swimming, calisthenics, aerobic dance, and more. Psychological techniques include self-hypnosis, mental imagery training, meditation, and other methods for focusing and improving strength. Therapeutic modalities include whirlpools, massage, ultrasound, music, and a variety of others that have a positive effect on both training and recovery. Medical support is necessary to maintain and correct health issues. Regular medical checkups and preventative care are essential to good health. Biomechanics is also referred to as skill training. Performing a skill perfectly will almost always result in greater force being applied. Dietary manipulation can help you excel at your sport or fitness activity, and nutritional supplementation takes up where your daily food intake falls short. Ultimately, as fitness educators, our goal is to utilize these 8 technologies to develop a process for our clients to enter a fitness lifestyle that complements their physical abilities, schedules, and available resources.